So, good afternoon again. I'm gonna talk to you about children's well-being. It's a special talk, actually. It's more a philosophical talk, and I would like you actually to think about it, to think what you are doing every day in your clinical practice, and how we all collectively can contribute to the well-being of our children. Again, I do not have any conflict of interest. I invite you one more time to come to the World Congress in Marrakesh. So, what are we talking about? Children's well-being is a combination of their physical, mental, emotional, and social health. This is how we define children's well-being. Well, as you know, there are many things that happen during hospitalization. So the child is in a different environment. He might be in pain. He might be exposed to completely unfamiliar medical stuff. He's in an unfamiliar place. And therefore, the hospitalization is a frightening and stressful experience. And this has been well demonstrated that will lead to postoperative disorders, either behavior disorders that can be on short term, that less than 2 weeks, like postoperative pain, separation anxiety, apathy, eating problems, sleep problems, or behavior and cognitive disorders that are more long term, like social problems, abnormal school performance, learning disabilities, and behavior issues. So, how do we create an environment where every child, no matter their circumstances, feels secure, supported, and ready to heal after surgery? So, let's go to the Convention of the Rights of Children that was declared by the United Nations in 1989, that is based on the promotion of the rights and the protection of children to develop their full potential, free from hunger and want, neglect, and abuse. The Article 24 of the United Nations Right for Children addresses the rights and the special demands of children in healthcare institutions. I would like here to consider consider the Safe Trust initiative, which is based on the safe conduct of pediatric anesthesia. You may wish to go to the website and look at the different chapters that are included in the Safe Trust initiative. One of them is the 10R, the rights of children. I summarize here. It's the right to enjoy the highest attainable standard of health, the right to non-discrimination, right to be protected from economic exploitation in healthcare, right to be protected from unnecessary treatment and investigation, right to avoid pain, fear, and stress, right to have their parents with them, right to privacy, right to be informed, right to be heard, right to be cared for together with children having the same developmental needs. In all situations, the best interests of the child should prevail, and that is written in the Article 3 of the United Nations Convention on the Rights of the Child. So, coming back to the well-being, that means that you have to focus on the child. That should be the child-centered care. That's the basis of the child-centered care. You have how to empower children, meaning that you have to focus on their individual needs. We have to encourage them to be involved in the decision making. We have to respect their input and autonomy when possible. We have to communicate with them with the language and tools that are child friendly. We have to address their fears, anxieties, and we have to coordinate the care to meet the child's specific needs. Of course, we have to adapt to the developmental considerations, and family may be central of the care of the process. So family-centered care balances the developmental needs of the child with the family's roles. So improving patient-centered care is, first of all, family is improving the family involvement in the child's care center. So, meaning that the family is the child's primary source of strength and support, and the child's and the family's perspectives and information are important in clinical decision making. This is what we call the triangle: family, child, family, and medical care team. Child, parents, family, and medical care team based on three principles: support and guidance, partnership, and collaboration. So, assessing the well being is assessing the health related quality of life. There might be some physical indicators. We know some of them, like the pain scales, the recovery time, physical health monitoring. But they can be psychological and cognitive assessment, like behavioral changes, cognitive development post-surgery, mental health screenings. We're going to look at some of them. And also, and most importantly, in order to have a holistic assessment, we have to get a feedback from the parent or family members. And this is very important to incorporate this in order to assess the health related quality of care. Recently, a systematic review of outcomes have been reported by the Pediatric Perioperative Research. And what they found in about 724 articles reporting more than 3,000 outcome measurements, that most studies, outcomes were measured in the immediate perioperative care, and the duration often restricted to the post-anesthesia care unit or the first 24 hours. Interesting enough, patient-centered outcomes and children's social and emotional well-being were poorly or not addressed. And when the group came up with potential metrics for quality outcomes. So you see here they highlighted the safety, effectiveness, efficiency, equity, timeliness, but there's a few items related to patient-centeredness: patient satisfaction survey scores and postoperative satisfaction surveys. So health-related quality of life is one of the most important core outcome, and it has been neglected in the pediatric anesthesia research field. In the adult field, you have a lot of studies on the health-related quality of life, unlike for the pediatric anesthesia. A study in the ICU, a scoping review, looking at health-related quality of life outcome measurements in children who survived from critical care. They looked at 66 articles, and most of the follow-up were done between 1 month to 10 years, and the median 3 years. Interesting enough, 15 different instruments were employed, and the minimal longitudinal follow-up was half a year, and there were infrequent assessment of the baseline health-related quality of life. So among those items or instruments and tools that were used, two of them were interesting to consider: the Pediatric Quality of Life Inventory and Child Health Questionnaire. I'm going to give a couple of things about the Pediatric Quality of Life Inventory. This questionnaire is based on 4 generic core scales with total of 23 items: physical, emotional, social, and school functioning. Interesting enough, the PETSQL can be completed by children and young people above 5 years, and there are 3 different depending on the range. Parents can complete those for 2 and 4 years of age. It has been translated in many languages. Unfortunately, it is protected by a license. It has been used mostly in chronic disease like asthma, congenital heart disease, and transplants. In anesthesia, it has been not used actually, to my knowledge, in any research. Child behavior checklist has been used particularly when we've been looking at neurotoxicity of general anesthesia. It's based on 113 items assessing a wide range of emotional and behavioral issues. It is validated only in children between 6 and 18 years. So when you think that it has been used in small children to assess neurotoxicity of potential neurotoxicity of general anesthesia, you may wonder the quality of this. Mentioned social competence and behavioral problem scale. The responses can be further divided into different scores. Internalization, this is dealing with anxiety, depression, and withdrawal. And externalizing, which is more aggressive and destructive behavior. And finally, individual syndrome scales like anxious, anxiety, withdrawal, sleep problems, or somatic problems. And finally, the other final questionnaire that has been used is the post-hospitalization behavior questionnaire. Unfortunately, this questionnaire has been abused and misused in preschool children. It's a very complex questionnaire of 27 items. There's no clear definition of the sensitivity, nor a cutoff, no real validity in anesthesia, and there is a difficult scoring. The reliability has never been demonstrated. So, was there any innovative approaches to well-being assessment? What are the future directions? Well, it is very important to develop international standards and assessment tools considering cultural and health systems. Assessing the well-being in Lebanon is different than assessing the well-being in Europe or in the US nowadays. Potentially, the usage of telemedicine or mobile app can help conduct multi-domain and multi-informant assessment with continuous monitoring. We actually, in one of the study looking at tonsillectomy, Blueberry study, we developed a mobile health app where the parents could enter for 7 days and 30 days what's going on with their children. This is a way of potentially in the future direction to assess the well-being of the children. Advocating global collaborative research and knowledge, and potentially being able to share between high countries, income countries, and low medium income countries to standardize assessment. And of course, develop training programs for well-being assessments. An important milestone was achieved 10 years ago. That was in 2015, where finally, during the World Health Assembly in Geneva in May 2015, finally, anesthesia was unanimously recognized emergency and essential surgical and anesthesia services as a component of a universal health coverage. A component of universal health coverage. What does it mean? It means that anesthesia and surgery can contribute to restore physical well-being, preventive premature death, and avoiding disability, thereby ameliorating financial loss. So the Lancet Global Health Commission developed a high quality health system based on the foundations and what is necessary to highlight a high quality system in a sustainable and current sustainable environment. And you can see here that the foundations are based on 5 items. What are the needs of the population? The governance, what are the policies, the insurance that we can put in place? The platform, how is the care is organized within this country for a given country or a given city? What are the workforces? What are the tools, equipment, medicines, and data? The foundations associated with learning, continuous learning for improvement of the process of care, to provide competent care, and to also for people have not only better health, to assess and have the quality of care that we are giving. All that in a global system, efficient, resilient, and equitable. What is important is to know that the health of children throughout their development and their future is intimately linked to the health of our planet. And interventions to improve health and well being during childhood have immediately and long term and intergenerational benefits, which compound synergistically. So, the Lancet Commission published something very nice, encouraging us to invest in children's health and education. And this is characterized by high benefit cost ratio. And as you can see, health in low middle income countries and education are two major components beside water and sanitation and maternal and child health. So, children of today hold the promise of shaping the world of tomorrow. We, as anesthesiologists, have a role to play in improving children's health and well being. I would like to encourage you to mark your agenda for the first Monday of October of each year. That is a Child Health Day. It would be nice in Lebanon to establish a specific day for the Child Health Day on the first Monday of October. This is dedicated for the focus of children's health and well-being all over the world. And also, you may wish to follow the Mental Health Week of the children between the 9th and the 15th of February 2026 next year. Each year it's about the second week of February. That's also an important week to raise awareness of children's mental health and supporting them to live happy and healthy lives. With this, I would like to thank you for your attention.